No, and
Yes, please, please
maybe.
feel free to get started.
All right. Well, I'm going to call our meeting to order this afternoon, December 4th at 2:02. Welcome, everyone. Great to see you. Great afternoon. I've been spending a lot of time with State Bar staff. I was just in our other legal aid fellows committee. I think Laura was there as well. So it's great to see everyone. And recording has started, if you've heard that. And we've got a few housekeeping items to go over. So I will allow staff to go through any housekeeping items that we have at this time.
Thanks, Efren. I'll go ahead and read the housekeeping items for us today.
Thanks,
Welcome
Ruth.
committee members, liaisons, and members of the public to the Legal Services Trust Fund Commission Homelessness Prevention Funds Committee. Thank you for joining us. We are using Zoom with the goal to foster a more inclusive environment and effective meeting. If you would like to comment during the meeting, please use the raised hand feature. Please utilize this tool to virtually indicate that you would like to speak in order to help the chair facilitate the discussion. A friendly reminder that this is a video conference and to please be aware of your surroundings behind you. All LSTFC and committee meetings will be recorded and posted to the State Bar website. Zoom captioning is available. To enable, select Live Transcript at the bottom of your Zoom screen and then select Enable Auto Transcription. Thanks.
Thanks, Brittany. And now, Jennifer, I'll ask you if you can call the roll.
My pleasure. Okay, so for commissioners, we can start with Escobedo,
Here.
Alicani, Iskin,
Here.
Mahoney,
Here.
and Sandville.
Here.
And then for our liaisons, is Selena here? I thought I saw Zach. Zach is raising his hand. We have Laura Brown and Melanie Snyder. And great. And then for staff, we have Kim Wormsley, myself, Rocio Avalos, Duan Nguyen, Chris McConkey. Am I missing anyone? Okay. So we do have quorum.
Great. So maybe as we thank you for the roll call, and great that we have quorum since we do have an action item today. So I see Kimberly is on with us and ask if there are any members of the public wishing to provide comment at this time.
Sorry, no one has their hand raised.
Great. Thank you for that. So our first item for action is approval of our minutes from our October 20th, 2023 meeting. Does anyone, having reviewed the minutes, have any questions or corrections they've identified in the minutes? Hearing none, we'll entertain a motion to approve our minutes.
I'll move.
I'll second.
Great. Jennifer, can you call the roll for the vote on our minutes?
Definitely. Alicani, Iskin,
Yes.
Mahoney,
Yes.
Sandville,
Yes.
Escobedo.
Yes.
The motion passes.
Wonderful. Moving right along, I believe we're now jumping into our agenda. So Jennifer, can you remind me, we will be then taking up our action item first. So which item are we moving to then?
Yes, so in order to take the agenda out of order and start with the action item, that will be agenda item 5. Which is, go ahead.
No, I was going to say, so let's take up item number 5. It'll be a little bit out of order. So we'll take up 5.1 and then make our way back up and take up items under item number 4.
Thank you.
Wonderful.
So item 5.1 is action item for this committee to approve the 2021-2022 through 2024 homeless prevention or HP3 grant reallocations. So I will turn it over to Jennifer, who will be presenting and also making the recommendation.
Thank you. Let me get into presenter mode. Oh, of course it started again. Sorry. This will be a preview of all the slides that are to come later.
I think we just memorized them all. We're ready.
Exactly. Okay. So once again, this is agenda item 5.1 to approve the HP3 grant reallocations. We'll go over some background, then discuss the reallocation process, the recommended reallocation amounts, and then the proposed resolution. And of course, if anyone has questions, please feel free to interject at any time. So this is a little background on the budget acts of 2021, 2022, and 2023, as well as HP3. So the budget acts of 2021, 2022, and 2023 allocated $80 million in combined in federal coronavirus state fiscal recovery funds for homelessness prevention legal aid. These were broken down as follows: formula for 75% after administrative costs, competitive was 25% after administrative costs, and the administrative costs to the State Bar and Judicial Council were 2.5%. And you can see the amounts broken down there. The Legal Services Trust Fund Commission made 75 formula grants and 23 competitive grants for a total of 98 grants. The formula grant period began on December 1st of 2021 and goes through December 31st of 2024. And the competitive grant period began a month later on January 1st, 2022, and ends on the same day, December 31st of 2024. Grantees have now reported on their spending for over half of the grant. So just to give a little background about the reallocation process. On March 24th of 2023, the Commission approved Public Counsel's request to voluntarily reduce its HP3 formula award by $1,167,136 and its HP3 competitive award by $562,603. As of December 31st of 2022, HP3 grantees had left 23% of their first year of funds unspent, and 14 grantees spent under 50% of their first year of funds. As such, staff wanted to make sure that we could propose solutions to ensure the maximum spend down of dollars in order to promote the fund's use for homelessness prevention legal services. In order to do this, staff collected each grantee's spending projections as part of the second annual HP3 evaluation over the summer. The evaluation instructed grantees to report the amount of HP3 funding that they anticipated remaining unspent on the last day of the grant, and noted as well that grantees who reported a number greater than $0 may be required by the Commission to reallocate that amount to other grantees. 5 HP3 formula grantees and 1 HP3 competitive grantee initially projected underspending. The Legal Services Trust Fund Commission invited these 6 grantees who projected underspending to confirm their projections of unspent funds. The Commission also invited all HP3 grantees who had concerns about spending down the grant to voluntarily relinquish funds. Ultimately, some grantees adjusted their amounts of projections and others did not. No grantees decided to relinquish HP3 competitive funds, and the following grantees relinquished HP3 formula funds. California Women's Law Center for $205,345, Child Care Law Center for $20,000, Greater Bakersfield Legal Assistance for $100,000, Legal Services of Northern California for $536,167, and Public Counsel for an additional $505,398. Together with the funds Public Counsel voluntarily relinquished in March 2023, a total of $2,534,046 in formula funds and $562,603 in competitive funds are available for HP3 reallocation. And this totals $3,096,649 between the two tranches. HP3 grantees must spend down the funds by the time the grant period ends on December 31st, 2024, or return unused monies. Reallocating some HP3 funds that might otherwise remain unspent will promote their use for homelessness prevention legal aid. So in order to do this, I'm sorry, was there a question? Okay. In order to do this, staff notified grantees that the Homelessness Prevention Funds Committee would reallocate some HP3 funds. Staff notified grantees that all current HP3 grantees, excluding those who relinquished funds, would be eligible to receive additional HP3 funds through the reallocation process. All relinquished funds would be reallocated to existing grantees via formulas. Specifically, staff ran two separate formulas, one for HP3 formula funds and one for HP3 competitive funds. And only grantees with a formula grant would be eligible to receive reallocated formula funds. Similarly, only grantees with a competitive grant would be eligible to receive reallocated competitive funds. In total, 46 HP3 formula grantees and 11 HP3 competitive grantees opted in to receive reallocated funds. Some grantees elected to receive smaller amounts of additional funds, so staff adjusted the formulas to redistribute remaining funds to grantees interested in receiving higher amounts. Grantees agreed to accept $2,534,042 in reallocated formula funds and $562,602 in reallocated competitive funds for a total HP3 reallocation of $3,096,644. And as a note, there is a $5 difference between the total funds available and the amounts reallocated. This was due to rounding. And in total, this is about 4% of the HP3 funds that were available to grantees that were then reallocated. So these next few slides just show the amounts of the current HP3 formula award for grantees who are participating, the proposed reallocation amount that they would receive, and then the proposed HP3 formula award, including this additional amount of funds. And as you'll see, the smallest HP3 formula reallocation would be $10,977 in additional funds, and the largest would be $469,134 in additional funds. As you can see on this slide, several grantees will receive this smallest reallocation of $10,997. On average, participating grantees would receive $55,088 in additional HP3 formula funding. And these are the totals for the HP3 formula reallocation. The smallest HP3 competitive reallocation would be $24,624 in additional funds, and the largest would be $88,919. On average, participating grantees would receive $51,146 in additional HP3 competitive funding. And this slide is the entire universe of competitive reallocation amounts, so it also shows the totals at the bottom. So now just a few notes on budget revision process. We use what's called a functional matrix to think about budget revision requests. If a budget revision is less than 10% of the grant, no approval is required. Budget revisions between 10 and 25% require staff approval, and budget revisions that are greater than or equal to 25% require commission approval. Staff worked with, yes, Eric.
Just to go back to the reallocation. So at the end of 2024, if any of the grantees don't spend any of their HP3 monies, my understanding is that money has to be returned to the federal government. Is that right?
That's correct.
And then who's responsible for that return? Is the state bar responsible, or are the individual grantees responsible?
So at the end of the grant period, grantees will submit paperwork confirming the amount of funds that they've expended. And based on that, our office will send out invoices to grantees.
But I mean, at the end of the day, if that money doesn't come in, is the state bar on the hook for it?
That is my understanding, but I would invite Duan or Rocio to weigh in if that's.
I mean, that may not be realistic. Maybe it's not a big deal. I'm just curious.
What happens is we remit the money to the Judicial Council, and the last time it happened, they sent it to the State Controller's office. They sent it back.
Okay.
Good question. So staff worked with California Women's Law Center, Child Care Law Center, Greater Bakersfield Legal Aid, Legal Services of Northern California, and Public Counsel. These were the 5 grantees relinquishing funds in order to revise their HP3 formula grant budgets. Staff reviewed these budgets to assess the following criteria, basically to ensure that personnel and program ratios were acceptable, to assess reasonableness in the movement of dollars, and to review whether the budget modifications included significant additional spending on capital additions. And none of these were major concerns for us. And this slide shows the overall breakdown of how the budget revision requests fall within that functional matrix. So as you can see, Child Care Law Center's revision percent was 4.5, so no approval is required, although staff did review. Greater Bakersfield Legal Assistance was 20.5%, so that was approved by staff. And then the remaining 3 budgets for LISNIC, Public Counsel, and California Women's Law Center were above the 25% threshold, so those will require, in this case, committee approval because authority was designated by the commission already. And those percentages you can see here for LISNIC, it's a 27.8% revision. For Public Counsel, it's a 53.9% revision. And for California Women's Law Center, we have a 57.6% revision. Staff is recommending that all of these budget revisions be approved. So next, let's talk about the budgets for grantees who are participating in receiving additional funds through the HP3 reallocation. Staff will work with all of these grantees in order to revise their HP3 grant budgets. Grantees receiving additional funds through the HP3 reallocation process will receive between 5 and 7% increases for formula grants and between 3 and 7% increases for competitive grants. Therefore, all 57 of these project budget revisions will not require approval. However, staff will review these budgets to ensure that they match the proposed award amount and to assess the same criteria, namely that personnel and program ratios are sufficient, reasonableness in movement of dollars, and whether the budget modification includes spending on capital additions. So I'm happy to take questions here, but this is the proposed resolution. And I can read it if that's helpful. Should the committee concur with staff's proposal, passage of the following resolution is recommended. Resolved that the Legal Services Trust Fund Commission, Homelessness Prevention Funds Committee, acting on behalf of the Legal Services Trust Fund Commission under its delegated authority, approves the 2021/2022 to 2024 homelessness prevention formula and competitive grant reallocation amounts as described in staff's memo and in attachment B, dated December 4, 2023. And it is further resolved that the committee, acting on behalf of the Legal Services Trust Fund Commission under its delegated authority, approves the HP3 formula grant budget revisions for California Women's Law Center, Legal Services of Northern California, and Public Counsel as described in staff's memo dated December 4, 2023.
Thank you, Jennifer. Any questions on the presentation or on the proposed resolution? Jennifer, I'm curious, just because of the significant amounts, if you have a sense of, say, public counsel, for example, sort of why so much of it being voluntarily returned. And what I'm getting at is I'm curious if it's, we tasted this money, we don't like it, here's your federal money back, we'll go search for state and foundation grants, or if it's more just structuring kind of the work didn't pan out the way they thought, or just more operational than fiscal for them.
Sure. I believe it was more operational. We worked pretty extensively with public counsel when they first came to us, I believe in December of 2022, and asked if they might be able to voluntarily return some funds. I think that many organizations had difficulty starting up their projects. There were some issues, and I can't remember if this was specific to public counsel, but some grantees applied for projects that may have relied on eviction defense that was not as relevant at the beginning of the grant due to eviction moratoria, for example. But I would say at the end of the day, ultimately, we really appreciate grantees volunteering to return funds when they know they can't use them, because as we've seen here, other grantees are able to use the funds. But whenever something like this happens, we do have conversations with the grantee to ensure that they have adequate technical assistance from staff to ensure that they can use the grant dollars that they were awarded as much as possible. Does that answer the question?
Yes,
Or other
that's very
questions?
helpful.
Okay.
Thank you.
Great.
Any other questions for Jennifer?
I see Jacqueline's hand.
Oh, yes.
Yes.
Jacqueline.
Yes, good morning. Sorry I signed on a bit late.
Oh.
Is this kind of thing typical? Does it happen often?
Sure, that's a great question. And I would say, I believe we did a reallocation for HP1, and we did a smaller reallocation for HP2 a few months earlier. So this is something that our office is beginning to do more of, but I don't know that it necessarily happens with every one of our discretionary grants.
Thank
And
you.
I think the part that was unusual is the fact that we got $80 million worth of federal funding. That hardly ever happens. Back, 10 years ago, we were lucky if we could keep things at 10 or $15 million. And all of a sudden, $80 million. It's just such a big swing that happened because of the pandemic. So I think it is unusual.
Yeah, it's kind of unfortunate because homelessness is such a big problem, and yet we have people returning money, and then people are complaining that not enough is being done about homelessness.
I'll add that I
Yeah.
think this is the positive line of this is that it was in reaction, the reallocation process and the need for it was in reaction to what we were hearing directly from grantees and what would best support the spending of these funds and redistributing them amongst existing grantees to be able to maximize their use. So as Jennifer mentioned, we really encourage that, and our staff working closely with grantees to make sure that we have a sense of what the challenges are and how in administrating these funds we can best support their best use within the time periods that we have available.
Yeah. I mean, I will make note that, and Jacqueline, this is, I think staff can best answer your question, but just in my experience, I mean, with the amount of funding that was distributed and the amount of folks that took some additional funding is great, but just even just the amount we're talking about of redistribution in the grand scheme, I think Jennifer mentioned 4%. I mean, that's actually really good, right? It's just 4% that needs to be reallocated versus larger amounts, which could mean a systemic thing where folks kind of really did it. So when I saw the amount, I was like, 4% is not that bad as in the grand scheme of how much money is out there being put to work and really supporting folks. So that's encouraging, I think, in some respect. Any other questions or comments? If not, happy to entertain a motion on the proposed resolution.
I also move unless there are any other questions.
Thank you, Eric. Do we have a second?
A second.
Thanks, Jonathan. Jennifer, would you like to call the roll?
Yes. Alikani,
Yes.
Iskin,
Yes.
Mahoney,
Vote yes.
Sandville,
Yes.
Escobedo.
Yes.
The motion passes.
Thank you. All right, so I think that is our one action item for today, and the rest are informational. So Eric, I know you'll be probably departing as you need to get ready for your event. But in any case, I believe then we're back up to agenda item 4.1, which is a report on HP 2, 3, and 4 grant annual evaluations. So Jennifer, I believe we're back to you.
Wonderful. Yes, I just wanted to make sure I didn't have to scroll through all the slides again. So here we go. As Ephraim said, this is a report on the HP 2, 3, and 4 grant annual evaluations. We submit these over the summer and early fall to the Judicial Council. So I'll be sharing some information with you today. So we'll go over some reporting requirements. We're actually going to skip the key terms. I'll talk about those verbally. Then we'll talk about the HP2 annual evaluation, the HP3 annual evaluation, the HP4 annual evaluation, and then some demographic analysis by HP needs addressed. So this is an overview of the HP reporting requirements. We can look at this by grant. So HP2, this was the second of third annual report. It was a 12-month reporting period. The funding source is state dollars. There is an annual reporting frequency. There are 80 total awards, and grant started in 2021, and the report covers the second year of funding. For HP3, this will be the second of 4 annual evaluations. The reporting period was also 12 months. The funding source is federal, which requires both annual and quarterly reporting. Grant started in 2021 and 2022, as we just discussed, and the report covers months 7 or 8 through 18 to 19 of funding. And then we have the HP4 report. This was the first annual report. It covered the first 6 months of the grant. This is state funding. The reporting frequency is annual. There are 63 total awards, and grant started in January 2023. So once again, the report covers the first 6 months of funding. You'll see an asterisk here. That's because HP4 grants were awarded in 2 tranches, initial and supplemental. Supplemental grants began July 1st of 2023, which was after the reporting period closed. So the HP4 annual report only includes the 46 HP4 initial grants. Okay, so the most important thing to share before we move forward is that the slides I'm going to share, the information I'm going to share for the rest of this agenda item are really just a snapshot of 1 year of the grant, or in the case of HP4, the first 6 months. And before we get into the details, just want to review some key terms. So economic benefits are financial awards or savings for the client. And grantees only report economic benefits when they were calculable and confirmed. So in general, anytime you see an economic benefit, those can be considered underreported, perhaps. You'll see the term HP needs addressed throughout these slides. That refers to the homelessness prevention legal needs that grantees addressed with an attorney-client relationship. These can include providing legal advice only through full scope representation. And HP needs addressed refers to the goal of the service, such as preventing eviction. When we talk about non-representation legal help, we are referring to other services that grantees provide to clients without creating an attorney-client relationship. These include self-representation clinics, legal workshops and trainings, community outreach events, and informational hotline calls. And then finally, when we refer to support center services, those are services that support centers provide to help qualified legal services projects through legal training, technical assistance, and advocacy. The State Bar required support centers to quantitatively report on this data beginning on January 1st, 2023. So prior to that date, support centers were encouraged, but not required, to report that data as available. So now let's dig into HP2. So the grant period, once again, is January 1st, 2021 to December 31st, 2023 for a 3-year grant. $31 million was allocated from the National Mortgage Special Deposit Fund. 71 formula grants were made and 12 competitive grants. The reporting period was January 1st, 2022 to December 31st, 2022, which covers the second year of funding. And during this reporting period, grantees spent over $9.7 million on homelessness prevention legal services, addressed 8,260 HP needs through attorney-client relationships for approximately 7,881 unique clients, recovered more than $1.5 million for clients through lump sum and monthly payments, attained more than $3.9 million in lump sum and monthly cost savings for clients, provided non-representation legal help through more than 700 self-representation clinics, workshops and trainings, and outreach events, and provided support center services through more than 800 trainings, convenings, and instances of research assistance and technical support. And once again, as a note to that last item, support center services were not required to be reported for this annual evaluation. So we can expect that those were actually higher. Next, we have the HP3 annual evaluation. Once again, that grant period began on December 1st, 2021 for formula awards and January 1st, 2022 for competitive awards, and will end on December 31st, 2024 for a 36 to 37 month long grant period. The grant consisted of $80 million from the coronavirus state fiscal recovery funds. Those are federal dollars. And 71 formula grants and 12 competitive grants were made. The reporting period was July 1st, 2022 to June 30th, 2023, which is 12 months. And that covers months 7 or 8 to 18 or 19 of funding. During the reporting period, grantees spent over $22.4 million on HP legal services. They addressed 12,812 HP needs through attorney-client relationships for approximately 12,003 unique clients. They recovered more than 5.9 million for clients through lump sum and monthly payments. They attained more than 5.1 million in lump sum and monthly cost savings for clients. They provided non-representational legal help through more than 1,200 self-rep clinics, workshops and trainings, and outreach events. And they provided support center services through more than 1,400 trainings, convenings, and instances of research and TA. And just to go back to that point on support centers, this data was only required for the latter 6 months of the grant. So once again, we might assume that this underreports the amount of support center services provided. And now on to HP4 annual evaluation. The grant period began on January 1st, 2023.
Jennifer, Eric has his hand up. I'm not sure if you.
Oh, I'm sorry, I couldn't see. Yes, Eric.
Yeah, question, and I'm sorry if you said this and I just missed it, but what is a cost savings?
Sure. So, for example, a cost savings is the amount of funds saved for a client.
Like through reduced rent or something like that?
Exactly.
Okay.
Yes. Any other questions? Okay. I completely forgot my place. So, HP4 initial grants began on January 1st of 2023. HP4 supplemental grants began on July 1st of 2023. All of the grants will end on June 30th of 2024. So the grant period will be 12 to 18 months. And there's an asterisk there because some grantees with HP4 supplemental awards elected to claim back expenditures and back services for the quarter beginning April 1st. So those grants will actually be 15 months long. The total grant award was $30 million from the Equal Access Fund, and those are state dollars. And there were 63 competitive grants made. Once again, there were 2 tranches, 46 initial and 17 supplemental. The reporting period was January 1st, 2023 to June 30th, 2023, which covers the first 6 months of the grant. Importantly, it only covers HP4 initial awards. And during the reporting period, HP4 initial grantees spent over 6.8 million on HP legal services, addressed 1,915 HP needs through attorney-client relationships for approximately 1,826 unique clients, recovered $873,129 for clients through lump sum and monthly payments, attained $631,038 in lump sum and monthly cost savings for clients, provided non-rep legal help through more than 316 self-rep clinics, workshops, and trainings and outreach events, and provided support center services through more than 152 trainings, convenings, and instances of research assistance and technical support. So for the next few slides, we'll review we'll do some demographic analysis across HP 2, 3, and 4 grants for their respective reporting periods. Oh, Ephraim, go ahead.
Yes, sorry, Jennifer, before you jump into the demographics, with HP4, I just, a couple points of clarification. One is when you said, so one of the questions was, are these equal access funds not federal dollars? You answered that. You said they're not. And then when you described the awardees, 46 initial, 17 supplemental, is that sort of taken as 46 were new grantees and then 17 were already HP 1, 2, or 3 grantees and you just added more funds? Or
great question.
How do you read initial versus supplemental? Yeah.
So initial and supplemental refer only to when the grants were made. So unlike HP 2 and 3, which have both formula and competitive grants, HP 4 was exclusively designed to be a competitive grant. It was
Okay.
somewhat unusual because HP4 was undersubscribed when we put out the request for proposals. Staff has various hypotheses about this. The grant period was shorter. It overlaps with both HP2 and 3 and actually ends before HP3. There were just several reasons that this grant might have been undersubscribed. So although the commission awarded grants to all applicants, there was there was a certain amount of funds that were left over. Obviously, we understood that there was a great need for HP legal services. So we put forth an HP4 supplemental proposal. And actually, all of the HP4 supplemental grantees already have either an HP1, 2, 3, or 4 initial grant. So yeah, does that answer your question?
It does. Thanks for clarifying that.
Sure. Were there other questions? Eric.
Yeah, if you go back to the slide you were just on, you were presenting with all the demographic information.
Mm-hmm.
So in addition to the California population, maybe another statistic that would be equally or maybe more important would be the California homeless population, which
Okay.
I just quickly looked it up on the internet, and that may not be applicable for all these years, but it's something like 170,000, 150,000, something like that. You can get the number, but I'm kind of struck by, so you look at that homeless population, 150, 170, something like that, and then the number of needs addressed in all 3 years. Well, I mean, I guess it's significant, but it's a rather small fraction of the homeless population, which makes me wonder. I don't expect you to know the answer to this question. I'll just sort of throw it out there. I'm not sure why, but does that mean that most homeless people are not experiencing legal problems, or that maybe even if they are, we're not able to address them? I mean, I guess what I'm saying is that the number of needs addressed, although it's substantial, it's thousands of people, it's a pretty small fraction of the overall homeless population. So I'll just observe that.
No, I really appreciate those observations and comments. And I think that it would be interesting to look at these demographics against the population of homeless Californians. I do want to give a few caveats, though. When we talk about the number of HP needs addressed, we're only talking about individuals where an attorney-client relationship was formed. So we can think about that in a few different ways. Not to minimize your very valid comments. On the other hand, many people who are experiencing homelessness or otherwise have HP needs are members of a family. And oftentimes the HP needs addressed, although there is one client, will benefit more than one individual. The other side of that is, again, when we collect demographic data, we're doing it only for those instances where an attorney-client relationship was formed. And the reports actually document the number of individuals who were helped through those other services, and it's substantially larger.
Well, so if that's a good point. So if in fact the impact of what we do, at least quantitatively, is significantly larger than the numbers here shown by the HP needs addressed, as your comment indicates, I'll just observe that maybe it would be useful in the future to try to capture that somehow in the data, so that we, when we get back to the legislature, we can say, we're really impacting a large percentage of the homeless population, if that's really what's happening.
Definitely, and those numbers are captured in our reports. Ephraim.
No, I think, Eric, I just wanted to appreciate your point. Say yes, that's good, and I would, I think even expand that in the sense that since these are HP funds, right? So it's homeless prevention. It's actually not just homeless population, but you're thinking about who are the rent burden or housing insecure. That I think, like, I think that's like over a third of all Californians, but it does reduce it from the 40 million to, you know, a third of that is likely housing insecure in California. But that's a great point. So just wanted to add that additional notice that it's like it's actually even bigger, right? Because it's homeless prevention. So it's actually even helping those that are rent burdened. A lot of them households with children.
Great point.
We
Duan.
all love demographics, so don't get us started.
I just wanted to, you know, our data around HP as well as a lot of our subject area is a little bit dense. So I know that our team is kind of going to be working this year and next year to make it a little bit more digestible, not just to the commission, but to the general population, and to make this data more accessible, because we shared, you know, with the commission, with the committee, but it's not right now readily accessible. So those are like a couple things that we're going to be doing that you'll hear a lot more. And then related to that, Jennifer and I were just at a conference at Stanford on Friday that we interface with, you know, at Stanford as well as some researchers at Berkeley. So there's kind of interest in partnering with us to maybe with either HP or some other issue area to do more like longitudinal kind of study, like maybe take a couple cases in some counties or a county or a couple organizations and do more like in-depth research, because we've heard the gold standard in terms of evaluations is following the client at 6 months, a year after. We do it at the moment of like case closure, but that's not the most effective way to kind of evaluate for long-term outcomes. So just so you know that is something that we are thinking about. It's very expensive to do. So it's not to say that we'll probably be able to do that across all of our grants, but there is probably an opportunity to do it in a smaller way and maybe extrapolate. So just know we're thinking about that. And I know Eric and I have talked about that for many years now. So I think it's finally the moment that we will probably be able to do something this upcoming year.
And I think at least just to add for this, as Duan mentioned and Jennifer, it's really helpful feedback. Like, what are the questions that come to you so that we are working on reframing this and, you know, knowing that, as was shared, it's like a snapshot of like one reporting period of a multi-year grant. And then what are the data points, and then what are like the key takeaways and what we compare to try to look at what the impact of those funds or of that work is. So if, you know, HP needs addressed, if we talk about, you know, case closures only in this reporting period and verified outcomes of those cases versus like what else we should be looking at or comparing against. So really helpful. Please keep sharing your feedback and asking those questions.
Okay, well, I second what Rocio said. Please do keep the questions and feedback coming. But just to kind of backtrack and give a little bit of a preface. So when we're looking at this demographic analysis across HP 2, 3, and 4, it's important to remember that this is just for the respective reporting periods that we've discussed. So really for HP 2 and 3, this is a snapshot of 1 year of the 3-year grants. And for HP 4, it's a snapshot of the first 6 months of HP 4 initial grants only. And just for the next few slides, the population info for California comes from census.gov and the American Community Survey for 2022, in case anyone has questions about those numbers. And what I really want to highlight here is that while men make up over 0.10% more of California's population, each of the HP grants served more female clients. In the case of HP 2 and 3, this was pretty significant. HP 4 less so. We also, as you'll see here, track different data than the census does and the ACS. So we collect information on non-binary Californians, which is not available through those sources. Okay, next we'll look at some demographic analysis by HP needs addressed according to race and ethnicity. And as you can see, clients who identify as Hispanic, Latino, Asian or Pacific Islander, Native American, or those who have more than one race or ethnicity were underrepresented by HP grantees for the reporting period. Conversely, Black clients represented between 16 to 18% of HP needs addressed, while they represent 7% of California's population. you know, we can draw some inferences about that as well. Next, we'll look at age, and we'll see that seniors represented on average 30% of HP needs addressed, while they comprise only 22% of California's population. So they were overrepresented. Conversely, children represented approximately 3% of HP needs addressed, while they make up 22% of California's population. And adults, which we consider persons aged 18 to 59, represented 67% of HP needs addressed on average, but only 56% of California's population are adults. And now we'll look at some underserved communities we've tracked through our data collection for HP 2, 3, and 4. Clients with disabilities represent 31% of the total HP needs addressed on average, while they comprise only 25% of California's population, so a slight overrepresentation. On average, clients with limited English proficiency represented over 19% of the total HP needs addressed, which is slightly more than the 17% of California's LEP population. However, it's really important for LEP demographics to look at this data disaggregated by grant. And we'll see that LEP clients were actually underrepresented in HP2 and overrepresented in HP4. And just so we're very clear, overrepresenting underserved communities, whether that's those listed here or thinking about race and ethnicity, gender, or age is not necessarily a bad thing, but we did want to share that information. So this is actually the conclusion of this agenda item, but of course, if there are more questions or comments, we're happy to talk through those.
Thank you, Jennifer. Great presentation. Data is always great to kind of get a sense of not just impact, but where and who's being impacted. And I'll just add that to your point. I would say I would characterize the sort of some of your observations on representation over representation to say that it's not even just that it's not necessarily a bad thing. I think it's essential to that's what equity looks like. So equity is not equal distribution and hitting all the representation targets. It's making sure that you are over indexing. So I actually think on our Black and African American community targets at the 17 is probably just about right, if not still even a little bit low. But you just can't look at the proportion of population. I'm curious, a question for you, and then that you're just presenting kind of the snapshots of the data. It doesn't mean it has a through line, but I did notice that in categories where Latino would be represented, so in limited English proficient, and then in the Hispanic categories, that there was a kind of progressive improvement on service between HP 2 through 4. So it looked like it bumped up. Was there something intentional behind that, or is just the way you guys put it out? How is it that it created such a big bump from, say, here with LEPs from 11 to 31? And then I forgot in the other slide with Hispanic category, from 25 to 36, just between those backgrounds. I'm just curious.
Sure. So I think a very large caveat that I would give is that because these are all different grant amounts, and HP 2 and 3 are both formula and competitive, whereas HP 4 is exclusively competitive. The project profiles for all of these grants are incredibly different. So we can't necessarily control for who applies and what kind of project is applied for. That being said, there is an emphasis with all of the HP grants on things like serving underserved communities, and I think you said it really well that thinking about, whether it's Black clients or LEPs or anything like that, we should be striving to overrepresent in those instances. So I don't know that we could provide any sort of definitive analysis as to why, for example, we see this increase between HP2, 3, and 4 with looking, for example, at Hispanic, Latino needs addressed. I would also say that it would be interesting and possibly not linear to look at something like HP2 for year 1, year 2, and year 3 for that demographic, for example. And that's something that we could, probably do very soon. But I think there are too many variables at play here.
Yeah.
And then in terms of the clients with limited English proficiency, I think that that's, a really interesting point. The only other caveat that I would give is that as we know, in California, the LEP population is incredibly diverse. So I don't know if it can map directly onto like the Hispanic Latino population of the state. I'm thinking, for example, of the large, we have large Asian immigrant populations in California, for example. So I think that it's a really interesting category because specifically it crosses so many different through lines of thinking about race and ethnicity. And it's just another way to think about underserved individuals. But it is interesting how it increases with each grant.
Yeah, no, and I'm don't require additional research. I was just curious if there was any intentionality or in some specific strategy shifts that kind of may have produced it, and maybe it was, more emphasis on immigrant populations or anything like. But no, I was just searching. It was just a curiosity seeing it, and with the LEP, I was, I know it doesn't directly index to Latino, but more as a corollary because it's usually. The two are going to move probably the same because of the impact of Spanish speakers on it. So this is great fun. I'm sure we could nerd out for ages, especially if you showed us even more data. We probably have even more questions. So appreciate that. I'll step back talking a lot, see if there's any other questions or comments. I think we have another item to go through as well, but want to be sure we everyone has a chance to ask any questions they have for this presentation. All right. I think that this concluded the evaluation presentation, right?
Yes.
Great. And this is an informational item, so no need to take action. So then why don't we move through the agenda and now round out to item, I believe, 4.2, which is an update on HP grant administration. And so back to you, Jennifer.
Thank you.
Feel like it's a little dance. So back to you.
Thank you, Efrain. So this will be a brief update on HP grant administration. So first, we'll talk about the HP4 spending and services review. So staff conducted spending and services reviews on HP4 grants in order to ensure grantees are on track to complete their deliverables and spend down their grants. We do these reviews periodically for multi-year grants to ensure that staff can provide technical assistance as needed to grantees in order to ensure the most efficacious and full spend down of these public dollars for homelessness prevention legal aid. So here's just a little bit of background on HP4 spending and services. And we've talked about HP4 already, but to review, the Budget Act of 2022 allocated $30 million in state funds for HP legal services. And once again, here's that breakdown of how the funding was expended. So there are 46 HP4 initial grants totaling $25,229,306. Then there were 17 HP4 supplemental grants for $3,270,694. And then administrative costs for the State Bar and Judicial Council were allowed for up to 5% or $1.5 million. The HP4 initial grant period, once again, began on January 1st, 2023, and will end June 30th of 2024. The HP4 supplemental grant period began July 1st, 2023, and will end June 30th of 2024. That's 12 months with, once again, the little asterisk that some HP4 supplemental grants actually began April 1st. HP4 initial grantees have now reported on their spending and services through June 30th of 2023, which is 1/3 of their grant period. So grantees reported spending over $6.8 million total, which was over 27% of their grants during the reporting period. Staff reached out to a number of grantees that it thought might be under target for deliverables. 18 grantees in total, 6 related to deliverables, 8 related to expenditures, and 4 to follow up on both. A few grantees revised their expenditure reports to correct errors and report additional funds expended. A few grantees indicated plans to submit budget and/or deliverable modifications and received technical assistance to begin those processes. And staff reviewed all of these explanations for reasonableness and to provide technical assistance as needed. So, when we do these reviews, we make sure that all of the work completed is qualifying. And then, as you saw here, to check for both reasonableness and proportionality of spending against activities reported, and most importantly, to identify programs in need of technical assistance. So the follow-up isn't just a question of asking, why didn't you report spending more money, or why are your deliverables low, but it's really a conversation with grantees about how we can support them to be as successful as possible with their projects. So just as a note, the reports, as we mentioned before, reflect 1/3 of the grant period. So perfect spending would have been $8,409,769, or roughly 33 1/3% of the HP4 initial grant funds. So that's the comparison point when we talk about 27% of their grants were spent during the reporting period. Some common reasons for low spend down were errors in reporting, which, as you see here, we have addressed, and plans to spend more for the last year of the grant, as well as the ever common issue of just grants taking a little while to pick up and that initial slow period. In terms of services, some common reasons for lower services were, once again, errors in reporting, slower than anticipated project starts and service uptakes, and hiring delays. And these are not unique to HP4. So just a note, after a few grantees revised their expenditures to report additional funds expended, grantees have reported an additional roughly $275,000, which brings us up to 28% of funds expended, which is pretty much on track for what we would expect for the first 6 months. Staff are following up with and providing additional TA to 3 grantees, and will keep the committee apprised as needed. But at this point, that is our report for that. Any questions about the services and spending review? Okay. In that case, the last sub-item of this agenda item is to talk about an HP4 oh, that shouldn't say services and spending review, I'm sorry. This is a budget review. So staff also received one HP4 budget revision request. And as a reminder, this is the functional matrix that we use for budget revision requests. The approval process, if a request is under 10%, there's no approval required. 10 to 25% requires staff approval, and 25% or more requires committee and commission approval. The request we received was submitted by Family Violence Law Center, and it was for a 4.5% revision. As the functional matrix states, the request does not require approval, but we wanted to keep the committee apprised. And that actually concludes all of my presentations for today, unless there are questions about anything.
So
Eric.
Jennifer,
Great
what
job,
were-
Jennifer, and appreciate all the work in these presentations. While they're not action items, I know a lot of work goes into them, and it's great to see that. Eric.
Yeah, what are we doing with, maybe it's not appropriate for this meeting, I'll just ask, what are we doing with the item that was so contentious at the last commission meeting? Is it appropriate to give an update on that, or should we wait?
I think the appropriate update would be to say that we are going to have a discussion about that at the commission meeting on December 13th. But Rocio, Dwan, if you wanted to add anything, please feel free.
I think that's an appropriate update. More to come on December 13th, unless if you wanted to add anything else.
Yeah, and I will share, Eric, that obviously we did our job as a committee, took it back up. We took it back up as a full commission. The action now and work was a commission level work, and we were waiting on some updates. I will share the staff has been doing work, and Erica, our chair, as well as myself, were invited to get a brief update. And so I know we're coming, but our committee's being involved by me being invited. I know I didn't need to, but because our committee is the lead committee on it. So there's work being done on it. There's more of an update and more information that has come. And so at our next commission meeting, which is where it's at, our committee's kind of done with the job, but at the commission meeting, we're going to be taking it back up and get more updates then.
So stay tuned.
Stay tuned. That's right. But I do want to, staff did a great job, and I love that they pulled me as a chair and our full commission chair to get that update. So we're being engaged. Great. Any other questions for Jennifer or staff? We have no closed session on our agenda. And with staff's permission, then I believe that gets us through all the items in our agenda. So would entertain a motion to adjourn. Do we do motions to adjourn, or no? We just adjourn.
Oh, we
okay,
just
then.
go home or stay
Yeah,
home.
then I'll just then use my privilege as the chair and say this meeting is adjourned.
Thank you.
Great to see you
everybody.
all.
Thank
Great
you.
work. And again, to the staff, thank you all for all the work you do